Back pain, or we can say lumbago, or even neck pain, is a rising condition nowadays. It comes under musculoskeletal disorders, and it is not limited to people who are working desktop job or people who are sitting for long hours. Now we can even see in children's, and obviously it's common in old age because of the degenerative condition. But all kinds of back pain or neck pain related to spine, they comes under musculoskeletal disorders, which involves bones, muscles, nerves primarily. Namaste, I am Dr. Abhijit Jinde, and today we will talk about how Ayurveda can be useful for such musculoskeletal conditions, particularly the conditions related to spine. Now, spine has, anatomically if you consider, made out of vertebrae. So the entire spinal column made out of this vertebrae holds or gives a space for the spinal cord in it. So any condition related to the spinal cord or this vertebral column and the muscles which are holding the spine in its position are related to musculoskeletal disorders of the spine. Now, why it is rising? The most common reasoning, the way we sit, the kind of job we are doing now, the sitting or even standing jobs which involves body posture which is continued for a long duration. So the same body posture for hours together is the main cause. The second main cause is the health of these organs, the health of bones, the health of nervous tissue, the health of muscles. These are affected because of nutritional deficiency, poor with vitamin B12, poor calcium, poor vitamin D, which helps the absorption of calcium in the bones, and poor protein intake, which makes the muscles weak. So, lifestyle, the health of the organs are the two major causes for rise in the spinal disorders. Now, Ayurveda has a very key role in helping in these conditions because the conventional therapies rely more on painkillers, physiotherapy, which definitely is useful to improve the flexibility or strength of the muscles. But once the painkillers, exercise therapy is done and the person is not responding, the next resort is surgeries. And the surgeries are not reversal, it is just fixation. The term used for spinal surgery is called spine fixation, where actually they screw the vertebrae together. So it is not the solution. If the lifestyle continues, if the food habit continues, if the health of bone, muscles and nerves are not good enough, after 2 years the same condition will happen in other part of the spine. So the next surgery is then suggested. I think people should understand that surgery is the last resort where it is affecting your mobility, then only surgery should be done. On the contrary, one should go for more restorative therapies. What Ayurveda talks about spine is one should have a good exercise routine. One should do oiling very frequently, oil massage. It may be a self-massage which is mentioned in lifestyle, dinacharya, at least once a week. That will improve the health of muscles, good nutrition to the joints. Third is the diet, which actually improves the health of muscle, bones, nerves, and in other nutritional terms, which will improve the nourishment of vitamin D, B, protein, and the other nutrients required for the health of muscles, bones and nerves. Ayurveda has a very good approach in treating this condition. It doesn't only fix it, but tries to completely reverse it. And once the patient comes to an Ayurvedic clinic for any spine condition, actually he is trained good enough to prevent any further relapse or prevent any other spinal conditions in different locations. So in Sukhayu, where I'm practicing for last 25 years, almost more than 60% of my clients are musculoskeletal disorders like spine disorders or knee pain. And the line of approach what we follow is first change the diet if there is some factors which are affecting the nutrition or which are creating more dryness in the system, in the bones, more degeneration. So first improve the diet. Then we do some therapies like Abhyanga, specific oil massages for the spine muscles to relax and to strengthen. Then we have different kind of steams which have different objectives. Usually the spinal muscles or the spinal conditions comes in 3 stages. First is the spasm, where the muscles are in stiffness. Second is because of the stiffness, the normal S curvature of the spine is lost. And that's where the second stage starts in. Because of the change in the shape, the space between 2 vertebrae is compromised and then the disc is pushed out. That is called the prolapse of intervertebral disc. This prolapsed disc then creates pressure on the nerves which comes out from that level of spine. Condition like sciatica is most common. So Ayurvedic treatment, particularly the steam, is different for all these 3 conditions. If there is a lot of stiffness, muscle spasm, we use therapies like leaf potli, which is called patra potli, jambir potli. Once the spasm is gone, then we have to strengthen the muscles. There comes the steam like pindaswed, the shastik potli, the rice potli, which nourishes the muscles, nourishes the joint space. If there is simple stiffness, then we do the nadi swedan, which is nothing but the steam from the decoction or certain herbs put in water. So different steams are used at different stage of this spinal condition. If the disc bulging is there, then we do Kati Vasti, which is the choice of treatment and the most promising treatment for disc bulging, where we pool oil for almost half an hour on the specific area where the disc bulging is there. Ayurveda uses, or rather all physicians of Ayurveda who treat spine condition, uses all modern diagnostic tools like MRI to see the disc kind of bulging, what extent the bulge has created compression in the spinal cord, or at which level the spinal cord is compressed. So modern diagnostic tools with Ayurvedic treatment creates a great integration for good relief and complete reversal. Mostly what happens, people once get relieved from the treatment of spine condition, they again continue their wrong food habits and wrong lifestyle. So Ayurveda has to be followed for prevention of relapses. Conditions like PID requires almost every year 9-15 days therapies to strengthen the spine periodically and to prevent relapses. In my practice, I have seen that patients who follow this treatment properly for the span of 9 days to 21 days, depending upon the severity, they immediately get out of the stage of pain and stiffness. But the main role starts after that. How to have a good digestion, how to have good nourishment. We also suggest specific yogic postures for spine on the last day of treatment, which they should continue throughout their life. So if they continue it properly, I have people in follow-up for 5-6 years post this therapy sessions who are doing good, who are not having any relapses. But I have also seen people who don't follow this yoga, exercise, daily, lifestyle things, or even good nourishment to bones and muscles. They again have relapses after 2-3 years. So Ayurveda is having a very promising cure for spine disorders. It is up to the individual who have to take responsibility of following the food and lifestyle and having a good nutrition. But in acute stage, the therapist definitely brings out the person of the painful condition. And Ayurveda can offer great cure, great relief for musculoskeletal disorders like spine conditions. Thank you very much.